Chest tubes. Chest tubes use gravity and sometimes suction to restore negative pressure and remove air or fluid, blood, pus, serous fluid that collects in the pleural cavity, allowing a patient's collapsed lung to re-expand and reducing respiratory distress. Nursing care involves assessing the patient's respiratory status, obtaining vital signs, monitoring for complications, and intervening appropriately. We should be assessing a chest tube every 4 hours. Check the suction status. Is the order to water seal? Should it be -20 suction? Note the color, consistency, and amount of drainage. Mark the drainage with a Sharpie every 4 hours. Note the date and time, and also make sure to chart that amount in Epic. Check the system for tubing kinks and bubbling. Check the chamber, have the patient cough. Bubbling may indicate an air leak. Use the tip and tilt method. Don't strip the chest tube. Assess the dressing site. Any crepitus would indicate a subcutaneous emphysema. Assess for any drainage as well. Never clamp a chest tube when getting a patient out of bed or when transporting a patient. This is really important. This prevents air and fluid from escaping from a patient's pleural space, which puts the patient at risk for a tension pneumothorax. These are the components of a chest tube. A is the suction regulator. It can be adjusted to a desired pressure level between -10 and -40, depending on the MD order. B is the water seal chamber. This chamber has a one-way valve that allows air to exit the pleural cavity during exhalation, but does not allow it to re-enter during inhalation. C is the air leak monitor. Continuous bubbling observed in the water seal confirms a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with a gentle float ball oscillation confirms the presence of an intermittent air leak. No bubbling with minimal float ball oscillation at the bottom of the water seal indicated that no air leak is present. D is the collection chamber. This collects the drainage from the pleural cavity. E is a suction monitor bellows. This offers visual indication of sufficient vacuum levels. The suction monitor must be expanded to the delta mark where indicated or beyond for standard -20 or higher regulator setting. To obtain a sample from the chest tube, you clean this port with an alcohol swab, attach a syringe, and then draw back. You can also obtain a sample by cleaning the tubing with an alcohol swab and pulling back the sample with a blunt needle and syringe. To apply suction when prescribed by an MD, connect the suction source vacuum line directly to the suction port located on top of the drain. For patient transport, simply disconnect the suction source vacuum line from the blue suction line connector. This is the same step you would do if you were changing the chest tube to water seal. If a chest tube is to suction, a patient must ambulate with portable suction. Equipment can be ordered in Epic in order to do this. An RN must accompany a patient during transport if a chest tube is to suction. If a dressing becomes saturated, you must change the chest tube dressing. In order to do this, you perform hand hygiene and don gloves, remove the existing dressing around the chest tube insertion site, examine the insertion site for signs of infection or subcutaneous emphysema, don sterile gloves, clean the insertion site with sterile water, place a 4x4 split gauze over the site and cover with Tegaderm to help seal the insertion site from any air entry and escape. Supplies to always keep at the bedside if you do have a chest tube is a sterile dressing, 4x4 gauze, tape, and a bottle of sterile water. In the case of an emergency, if a chest tube falls out, immediately cover the site with sterile petroleum dressing, dry gauze, and then tape on 3 sides. If a chest tube becomes disconnected, immediately place the chest tube end in a bottle of sterile water. This helps create a water seal. Lippincott is a great resource to use. You can find it on the source under apps and then scroll down to Lippincott procedures. It goes through step by step how to replace a chest tube drainage system with a new single use sterile kit. It also goes through troubleshooting chest tubes, what to do if the water level in the water seal chamber is not rising and falling with breathing, what to do if there's constant bubbling in the water seal chamber. So be sure to check out this great resource. Thank you.